with you both again in this Congress. Secretary Kennedy, things are not going well. It's clear what you are doing across HHS is devastating to children, families, seniors, millions of Americans that HHS programs support. Now, you were required to send us an operating plan detailing how you are spending funds that Congress provided for programs that families rely on. You sent us what you titled the, quote, Hill version, which had over 530 asterisks in place of the funding levels. Mr. Secretary, we need the real version with actual funding levels. This committee needs to know how you are spending taxpayer dollars right now and what programs you are cutting and which you are eliminating. You are blocking billions in funding that Congress appropriated from going out the door, including $3 billion at NIH, $1 billion in Head Start, and $3 billion in child care funding alone. And that's on top of all the other funding you have illegally ripped away. $11 billion from state and local health departments, $1 billion supporting local substance use and mental health programs, and $66 million in Title X funds for cancer screenings, birth control, and preventive care. We know you're dismantling HHS and throwing away generations of investments in our healthcare system and firing critical employees. We are talking about the people who administer Head Start, LIHEAP, Meals on Wheels, or entire teams who are working on preventing chronic disease and Alzheimer's, tracking IVF success rates and safety, maternal health, more. On top of all of this, you propose a budget now with truly devastating cuts that would leave America sicker and weaker. But you're not waiting to see whether Congress approves that budget proposal. This administration is starting to unilaterally implement it right now, in defiance of Congress and the laws we passed. If you aren't already, you're sprinting down the road of illegally impounding billions in funding through intentional action and incompetence. So to my colleagues on this dais, we heard several weeks ago from experts across the country what we risk by ceding American leadership on biomedical research. If we bless these staffing and funding cuts across HHS, that means deciding that we are comfortable with China leading the future development of every drug, device, and vaccine. The supply chain challenges we faced during the pandemic will be the new normal. Our access to the latest treatments and cures will depend on other countries. It's time to stand up and assert Congress's authority. This committee has dedicated itself in a bipartisan manner over decades to make sure we are the global leader in research and development. And now all of us know this administration is now setting us back where it may take decades to regain that position. If we don't, decades of scientific breakthroughs and medical discovery and the bipartisan work to support them risks being burned to the ground, and it will be very, very hard for us to rebuild that. We should be setting this country up for failure. We have to do better. Now, Secretary Kennedy, listening to your testimony last week, frankly, left me pretty confused and concerned about what is happening at your department. You repeatedly claimed that staffing and funding cuts that have been reported on publicly and even confirmed by your department staff are not happening. So either you're lying or you're not the one making the decisions. You said, and I quote, "I made sure that Head Start was not cut," later going on to say there should not be any delays, the funding is there. Well, Mr. Secretary, HHS is delaying billions in funding for Head Start and child care. These funding delays meant that a Head Start program in my state that serves more than 400 children had to close its doors and left parents scrambling. So let me ask you about another child care issue. Secretary Kennedy, whose decision was it to withhold child care and development block grant funding?
Senator, I want to point out that in 2021, at the beginning of his administration, President Biden submitted his budget on May. You know what? You made an accusation of me, and I'm going to answer it.
Okay, I appreciate
on May
that.
28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can.
And I also want to point
out. I have just 2 minutes left. I asked you a specific.
I want to point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well,
Our people are now the
Mr.
sickest people in the
Secretary,
world.
seriously.
Because you have
Mr.
not done your
Secretary,
job.
seriously. That is an
What have you
amazing
done about it? What have you
Mr.
done about the
Secretary, I
epidemic
am here
of
to
chronic
ask-
disease?
Mr. Secretary,
What
you
have
are
you done
here in
about
front-
the epidemic
Mr.
of chronic
Secretary,
disease?
seriously, Madam
Mr. Secretary,
Chairman.
I would ask you to hold back and let the senator ask the questions.
Mr. Secretary, I'm asking you a question about child care. I'm asking you who made the decision to withhold child care and development block grant funding.
That was made by my department.
Okay, and you said last week, quote, "We were not cutting thousands of scientists, we are not cutting clinical trials." But I want you to know, in the last 4 months, you fired or pushed out nearly 5,000 NIH staff and terminated more than 1,600 NIH grants. That includes more than 240 clinical trials across the country. So whose decision was it to fire scientists and terminate these NIH grants and the clinical trials?
Senator, I don't trust your information with all due respect. You told me 3 days ago or 4 days ago that we had cut a clinical trial in your state, and what you said turned out to be completely untrue, and you knew it was untrue because you corresponded with Jay Bhattacharya before
Madam
that.
Chairman, I will answer that. It shouldn't take me, first of all, raising an issue with you face to make sure NIH is working its way through this. The woman that was in question, as I clarified to you at the last committee, was qualified for a clinical trial, unlike you stated. So
Untrue. Untrue.
No, that is true.
Untrue. She qualified this week. We shouldn't be talking about patients' private information.
I agree.
Anyway.
And let's leave that. And I will just say your staff didn't get back to me till 45 minutes ago.
We have the emails. We have the emails from your staff
Madam Secretary,
2 weeks ago.
Mr.
2 weeks ago,
Secretary,
you were corresponding.
seriously.
What you said, you knew was untrue when you said it to me.
You came here to argue with me. I came here to ask you questions about your budget request. Your budget request is asking us to cut dramatically, but I am also making the point that Senator Baldwin made, that what you are doing right now is enacting your budget that Congress has not passed by cutting critical funding across the board. And I think this committee will find that to be very detrimental in the future. Thank you, Madam Chair.
Senator Hyde-Smith.
Thank you, Chair Capito and Ranking Member Baldwin, for this meeting.
In a tense exchange on Capitol Hill, senators pressed Secretary Kennedy on what they describe as drastic and dangerous cuts across the Department of Health and Human Services, cuts they say are already harming children, families, seniors, and millions of Americans who depend on HHS programs. The hearing opened with sharp criticism. Lawmakers say Secretary Kennedy failed to provide Congress with a complete and transparent operating plan, instead submitting a version filled with more than 530 missing funding details. Members of the committee warned that without the real numbers, they cannot assess how taxpayer dollars are being used or which programs are being reduced or eliminated. According to the committee, the administration is blocking or delaying billions in funding that Congress already approved. $3 billion for NIH, $1 billion for Head Start, $3 billion in child care funding. This comes on top of what senators called illegal rescissions, including $11 billion from state and local health departments, $1 billion for mental health and substance use programs, $66 million from Title X services like cancer screenings and preventive care. Lawmakers accuse the administration of dismantling HHS by firing key employees and shutting down programs tied to chronic disease prevention, Alzheimer's research, maternal health, child services, IVF safety, and more. They warned that the cuts threaten decades of bipartisan investment in America's biomedical leadership, potentially ceding future medical innovation to China. The committee argued that by acting before Congress approves any new budget, the administration is effectively implementing its own cuts without legal authority. They warned that continued impoundment of funds could violate federal law. When questioned directly, Secretary Kennedy insisted that major programs like Head Start were not being cut. But senators pushed back, pointing to real-world consequences. In one state, a Head Start center serving more than 400 children was forced to shut down due to delayed federal funding. Pressed again, the secretary confirmed his department made the decision to withhold child care block grant funds. The confrontation escalated when the topic turned to NIH staffing. Senators said the department has fired or pushed out nearly 5,000 NIH employees and terminated more than 1,600 research grants, including 240 clinical trials nationwide. Secretary Kennedy disputed the accuracy of those numbers and accused senators of presenting false information. The hearing grew heated as both sides challenged each other's claims, with disputes over staff communications, timelines, and specific clinical cases. Despite the clash, senators emphasized that their primary concern remains the same. Critical health programs are losing funding now, long before Congress has voted on any new budget proposals. They warned that the move could weaken America's healthcare system for years to come. The chair eventually moved the hearing forward, yielding to the next senator for questioning.